Awesome. So I have a few items that I have here today, but I thought I'd start by introducing myself. Some of you have seen me before on these classes, but I haven't done them in, I think, just under a year. So I'm excited to be back and to be doing some bunion and toe specific exercises. I'm an athletic therapist, so just like Lindsay, I am specialized in muscles, joints, and bones. But my interests or things that I find really interesting and intriguing are foot injuries, so ankles to basically your shank, which starts at your knee down to your foot. And so that's kind of why I chose to speak about this in the class today. I'm glad that so many people were interested in this specialty, and hopefully I can give you guys some guidance. And if you have any questions at any point in time, just feel free to ask away. We're going to go through a little bit of anatomy to start, but first I'll give you a little rundown of what items we have here, which I appear to have lost one. Okay, so what you're going to need is a few coins. So like, doesn't have to be like a loonie or a toonie. It can be like pennies or quarters or dimes. A spoon is going to be helpful. Your socks, a towel, and then a lacrosse ball, which I have one, but I appear to have had it roll away on me. So I'm just gonna search for as quick as I did. Or grab another. Oh, it's right here. There we go. And a lacrosse ball. So the lacrosse ball is what we're primarily going to use to start off with, and then a towel. So I'll give you. And a towel. Awesome. So it looks like people are coming back, but I'll just make sure to go through this just one more time because I know a few people just popped on. So our items we're going to use today are some coins, a lacrosse ball, a spoon, a towel, and some socks.
Socks. I gotta get socks. What does the lacrosse ball look like again?
It can be like a golf ball or like a tennis ball. Those work too.
Okay.
Just like a massage ball. Sometimes people.
Okay.
Hi, Jill. Thanks for setting this up. I'm going to go grab a towel and some socks, and I'll be back in 30 seconds. Barry.
Awesome.
This is about an hour, is it, Jill, or half an hour?
I think it says 45 minutes, but
Okay.
we may kind of in between 45 minutes and an hour.
Okay, and just find a place on the ground. We need like a yoga mat, or what's the thought? Or you'll find out,
Be on
I
a
guess.
chair or on the ground, whichever you feel most comfortable with.
Oh.
It's good.
Let me hang. Just a minute. Okay.
Awesome. So I thought I'd start off with a little bit of anatomy. So I'll kind of come nice and close to the camera so you guys can see. So this is the anatomy of the bottom of your foot. I'm just going to show the recording as well. And so the bottom of your foot has 19 muscles that contract when you walk. So there's 39 muscles total that are a part of your foot and ankle joint, and there's 19 specific ones for walking, which is pretty incredible. There's about 270 muscles in the body total. So it's really quite neat that there's 39 just in the foot, which is quite incredible. So the ones that we're going to be focusing on today are called the intrinsic and extrinsic muscles. So I'm just going to flip the page to the next page so you can have a better detail. So these are these little ones in between that white line there. Those are called your intrinsic muscles. Those muscles help to contract your toes. They help to create space and stability in your ankle. So that's these guys. So these guys are the intrinsic and muscles right in between these white lines here. And then we have the extrinsic muscles. So your extrinsic muscles primarily control your big toe and your pinky toe. So your big toe on this side. So these big muscles on the side here. And on the side here, those are the extrinsic muscles. So those guys control the splitting of your toe, as well as if you have bunions, oftentimes these muscles are the weakest when we have bunions. So we're going to focus on making sure that those muscles are feeling nice and strong, as well as in good position to help your foot recover. So these guys here. Awesome. Do you guys have any questions so far?
Nope.
Awesome. Cool. So the first item that we're going to grab is a lacrosse ball. I'm actually going to tilt you guys down a little bit so you can see what I'm doing with my feet. I apologize. You get to stare at my feet for a little while. Okay, so I'm going to sit on the chair. You can do this standing. You can do this seated. You can do this from the ground as well. Standing is going to be the most pressure, but seated is going to be a little bit less pressure. So what we're going to start off with is just gently rolling back and forth. So not putting a ton of pressure in the joints, we're just rolling back and forth. So what we're targeting in this instance is more of the fascial system. So if you've taken a few of Lindsay's classes, she's probably explained a little bit of the fascial system. So at the bottom of our foot, we actually have something called the plantar fascia, which is something called the aponeurosis, which is like a really thick tendon on the bottom of our foot. And fascia is like the skin on the muscle. So it is that contractile properties. So if you understand what a transmission is in a car, your fascia is kind of like a transmission. It connects the neural connection to the muscles. So that's why it's quite significant and can affect your body when you have like a fascial adhesion or just overall fascial tightness. And then we can flip to the other foot. Get that bottom of the foot nice and warm.
Are we putting a lot of pressure on it or just kind of rolling it back and forth?
Just kind of rolling it back and forth, not putting a ton of pressure. We will put a little bit more pressure in a minute, but at the moment just going forward and back. It should just feel like a light massage. So you can keep doing that. I'm just going to come a little bit closer to show you something. So the next part that we're going to work on is this part. So just underneath your toe pads. So your toes are here, and then there's that like kind of pad part. We're going to focus this next time, or this next activity right in here. So right kind of underneath that pad of the foot. So right in this area. Okay. So what you're going to do is either seated or standing. What you're going to do is create kind of a rainbow. So placing that ball underneath the pad of the foot. You're just going to create rainbows with your toes. So trying to touch your big toe and then trying to touch your little toe to the ground. So this one is particularly helpful for bunions because it works on the tension in the adductor muscle. The adductor muscle pulls your toe this way. So it creates this contraction, pulling your toe inwards. So if that guy is super, super tight, then it's going to pull this toe inwards like that. So again, you're just going to do kind of like a rainbow, tracing side to side, kind of a moderate pressure into that area. Excellent. So the next one, you're going to slide that ball to kind of the back portion of your foot. I'm going to turn sideways so you can see. So kind of like you're wearing high heels, kind of where that heel of your high heel will go. You're going to place the ball just in this area. So just before that fat pad. So just before your heel, there's like a little divot. You're going to place that ball right in that area. Just right there. Excellent. So placing that ball right there, you're going to touch your toes down to the ground. And then what you're going to do is create a little bit of pressure. Now this shouldn't be painful, but you may feel like some pressure or even some tension into your pinky toe. If you're feeling adventurous, you can put more weight into it and kind of swivel forward and back.
The arch of the foot kind of has the fascia pain threshold.
Yeah, like into the fascia. Good. Excellent. So this next one, so your hallux is what we call your toe. It's like the anatomical term for it. So what we're going to do is we're going to do a hallux tendon stretch. So you can do this seated or standing. It may be easier a little bit seated because you can control the ball, or you can be standing. So what you're going to do is place the ball underneath your big toe and really press into that ball. flip around so you can see the other direction in case it makes it easier.
So Jill, the idea is we're trying to stretch the fascia and different muscles in our foot.
Yeah, so for this guy, we're actually stretching the hallux tendon, so not a muscle. For the rainbows, we were working on the adductor muscle, so we were actually doing a self-massage for the adductor muscle of the foot. So the deeper we press, the further we get into the muscles. So a light pressure really gets into the fascial system. As soon as you start putting a more significant pressure, you're getting into more of the muscle tissue or the muscle belly.
Want to keep your heel down?
Yep. Excellent. So we're going to go back to those rainbows and we're going to repeat it on the other side. So either standing or sitting. So again, taking that pinky toe and then the big toe. So just below your toe pads here, in this area. Excellent. So moving into the heel pumps or pushing into the heel, you're going to bring your toe forward. Again, placing that ball just in front of your heel here and pressing into that deep muscle, into that hallux muscle. Now with some of these exercises, sometimes people get, well, not these ones, but some of the ones coming up, sometimes people get kind of an arch cramp or a cramp in the bottom of their foot. So if that does happen, we do have a solution at the very end that I'll go through that might be more, more suited for you if you are getting that cramping feeling with any of the strength exercises. So we're going to do 5 or so more heel pumps. And then we're going to go into that hallux stretch. So on the opposite side, you're placing that ball just underneath your big toe. You're getting a really deep stretch into that hallux tendon.
Question, Jill.
Yeah.
So I've got an osteophyte on my first metatarsal. So this hallux stretch really just creates a pinch.
Mm-hmm.
Is there anything as an alternative, or I'm just kind of mechanically screwed?
No, you can do what you can do is using your hand if you can reach, and just
Okay.
go just below before you get that that pull.
Okay. Thanks.
It always seems like 60 seconds. It seems like a long time. It's like, ah. But if we want to create more change in the actual length of tissue, holding it for longer is going to create a more significant or more consistent change. So that's why we hold things for what seems like a long time. Okay. Take you guys back up. Okay. So next we're going to grab the spoon. I know this is a little strange for some people to be using a spoon. I hope you wash it afterwards. So we're going to be applying, actually first, if you have your sock, what I want you to do is with one foot, one of your feet, you're going to wrap your sock between your toes. So if you have toe spacers, this is kind of doing the same thing. This is just a more economical version. Wrapping your sock.
Can you repeat, please?
Yeah.
Possible to repeat it again?
Yeah. So with the sock, what you're going to do is
Oh,
wrap
wow.
it between. So it might not be able to get between every little toe, but you can wrap it in between each toe.
Where did you keep the spoon?
Oh, I'm going to use this.
And how about the spoon? Oh, later, right? Yeah. Okay.
Yeah, we haven't used the spoon just yet. So wrapping it between your toes. And if you can't get around every single toe, that's okay. The main ones are the big one and the little toe that are important. Okay, so keeping that sock there, you're going to use your other foot. And so what we're going to do is we're going to massage with the spoon. So I'm going to move this guy here. Bring it nice and close. You get up close and personal with my foot. Okay, so if you want to, you can apply lotion to your foot, but if you don't want to, that's perfectly fine. The spoon, because it has a smooth edge, should be okay. So what we're going to do is your big toe is here. You're going to find that bone just on the very top of your big toe here.
So this is another leg, right? Not the same, right?
Not the same one. So the sock is in the other foot, and then we're using the spoon on the foot without the sock.
Okay.
Yeah, so we're just finding this big bone here. And then in between, so this big bone's here, you're going to roll off of that big bone. And then you're going to take the spoon and you're just going to gently pull upwards. So as you pull upwards, it's totally normal to feel, particularly if you have tension in the muscles of your big toe, it's totally normal to feel kind of like bumpiness or like Rice Krispies, as some people call it. So what I'm doing is I'm gripping the spoon kind of like this, kind of like a fist, and then pulling upwards.
Just between the big and next toe, or all between all toes?
Just between the big and next toe first.
Thank you.
Okay, so for the little toe, what I want you to do, so there's a bump. You'll find your little toe on the side here. There should be kind of a bump. That is called the base of your fifth metatarsal, which is your baby toe. So it's the very base of your baby toe. So your baby toe actually starts about here. So what you're going to do is you're going to actually reach under that foot, and you're just going to scrape down. So scraping towards your heel. Now, it doesn't have to be perfect. Everybody's anatomy is different. And the amount of pressure that you apply depends on how much you can tolerate. So if a lighter pressure feels better, then that's good. If you want to really dig in there, that's perfectly all right. If you are digging in there, you're going to get to more of the muscle as opposed to the fascial system. So if you've got pinky toe pain or outside of the foot pain, this is a really good spot to get into. Because, well, it's more common to have bunions on your big toe. You can also have them on your little toe as well. Okay, so now I've just switched up. So I'm going to come from that bone and then I'm going to work up to the little toe. So starting at that little itty bitty toe, if you lift your toes up, you should be able to see a little tendon there. I want you to go just beside that tendon. I'll come a little closer to this camera here. Right in here. So taking that spoon, really pulling down. If you want an increased intensity of that pinky toe area, you can take your pinky toe and as you scrape downwards, pull your pinky toe down. If your skin is turning a little bit darker or turning a little bit pink, that's perfectly okay. If it's turning super, super red or super, super dark, you may be pushing a little bit hard and it may be bruising. The bruise shouldn't be too debilitating, but you may want to let up just a little bit. But we are getting into that muscle system, so you can go deep if it feels good.
Jill, is your spoon edge down or bowl down?
Okay.
Okay.
I'm using the edge of the spoon.
Kind of convex versus concave, okay.
Yeah. Now you can use the back side of the spoon. It's going to be a little bit lighter in that sense. Good. Shake out your toes. And we're going to switch the sock to the other foot now. So wrapping that sock again just into the other toe. Or other foot, rather. Good. Now we're starting back at that big toe on this side. sorry. So again, we're starting at this big toe on this side. And you're kind of scraping downwards between the big toe and the second toe.
Bill, on the pinky toe, you said where the bump is halfway down your foot, that's where the flange starts. Are we supposed to scrape along that edge too?
So we're starting at the big toe at the moment.
Okay. And I'm just going back to your other talk about the pinky. It was just kind of understanding the anatomy and where things were, what that bump was.
Yeah.
Okay.
Yeah.
And again, why are we wrapping the off foot?
So we're creating a little bit more space between those toes. So that's a little trick that a lot of people recommend. It's often they try and sell you these things called toe spacers. So putting a sock in between your toes does a very similar thing. So we're just gently stretching those ligament structures with the other sock.
And there's a benefit for that. It's a good thing to do.
Yeah, you can do that at any point in time. Some people recommend sleeping with them. I can't personally do that, and I know it's kind of a struggle for some people to do that, to sleep with something between their toes. But you can, if you're resting, watching TV, you can wrap a sock between your toes. And we have a little exercise later that you can even do to strengthen while you do that.
And I guess just the rationale, like why are we stretching our toes with a toe stretcher or a sock? It helps somehow.
So there's many, so the plantar fascia, which is actually an aponeurosis, which is a type of ligament, is a ligament that runs from the bottom of your toes to the back of your heel. And with the spacers or with the sock between your toes, you're creating a little bit of stretch to that ligament. So the reason that we want to stretch that ligament is because it is a very contractile ligament. And so as we sleep and as we rest, it tends to pull itself into a little contractile or contracted position. So by putting the wrap between our toes, we're allowing it to kind of do the opposite. So we're creating more space. As well, if you wear a lot of pointed toe shoes, that contraction can happen during that while you're wearing those shoes. So now we're going to go to the back side of that foot. So back to that pinky toe. So finding that bottom of that phalange or bottom of your pinky toe here, we're going to scrape from the pinky toe to the heel. Sorry. How can you tell I'm left-handed? I like to demonstrate my right side.
Jill, is there any of this related to I think babies have the Babinski effect where you touch the bottom of their arch and their feet will splay forward?
Yeah, it can be. For most adults, it should be, that reflex should be all but gone. But it can be connected to that mechanism.
I broke my leg and atrophy because of being in a cast. They talked about you revert to some old things like the Babinski effect that babies have with their feet.
Yeah.
And you have to start over.
Cool. Excellent. So if you feel like that bottom part of your pinky is feeling good, you can move to just between the little toe and the second little toe into the front of that foot there by the pinky toe. Awesome. So shake out your toes, see how they feel. So next we're going to focus into some strength activities for the foot. So for these, you're going to need those coins and the towel. Okay, so let's start with the coin activity. So let me see if I can you guys see my toes here? So what you're going to do is either standing or sitting. You're essentially going to try and pass the coins between your toes. So this requires your toes to do kind of this motion to be able to pass the coins between your big toe and your little toe.
Do we need a wooden surface? Because on carpet it's not moving fast.
Yeah, it might be tricky on carpet. An alternative for carpet that you can do is called a towel curl. So with the towel curl, instead of passing the coins, you can grip the towel and pull it towards you. Or you can use the carpet to
But
protect.
then we,
So if you have grippy carpet, you can just sit there and grip the carpet. I believe there's a movie where he he does that in the airplane. I can't remember which one it was, but somebody told me that this was an exercise from a movie. I had no idea.
so we should do two legs together or one leg, one each
I
leg.
was just doing one so you could see, but you can do two legs together. Excellent. So this next one, you're going to take the back side of the spoon, so the end of the spoon, you're going to place it underneath your foot until you can feel it just in your arch there. Okay, so once you have that spoon there, what you're going to do is you're going to try and contract the bottom of your foot. Now your big toe shouldn't lift off. It's kind of tricky to not let it lift off, so you're not like pulling up this way. You're keeping the pad of your big toe down and you're squeezing this portion of your foot.
You know that by when you don't feel the spoon underneath anymore?
Yeah. So the spoon, or you can use a pen, is a good kind of proprioceptive cue, which is a tactile cue for your body to say, oh, I'm actually doing this. Which is kind of fun.
How about other fingers? Other finger it can come little bit up.
Pardon?
Not the toe. Is it okay if other finger is coming little bit up, because toe is not coming, but other fingers?
Like your baby toes are coming up?
It can come.
Yeah, that's okay.
Not baby toe, middle.
The middle one?
Yeah,
Like
that three, yeah.
Yeah, that's okay.
Yeah. Yeah.
That happens. They like to help. Good, so we're going to switch to the other side so you can do it on both feet. So we're going to do about 10 on each side.
So Jill, this is a lot. Is this something that you suggest we do once a day and it takes half an hour to try to fit it into your schedule?
You can probably pick some of your favorites and do about 3 or 4 of them. If your foot is feeling really sore after like a high intensity activity, I would do a lot of like the massaging stuff that we started with. But if you're trying to increase the strength, maybe do a little bit of that first rolling and then go straight into the strength activities.
I was told this one is supposed to be very good to try to keep your toes straight and reduce the idea of a bunion by shrinking your foot, if you will, by keeping your toes from scrunching.
Exactly.
Arch muscle.
Yeah.
And I'm not sure the real name of an arch muscle is. I'm sure you know it.
Yeah, there's the short foot muscles, but I call them the intrinsic muscles. So there's different names that people go by, but there's a whole bunch of intrinsic muscles, and that's kind of what we're working on with these guys.
Great, thank you.
Yeah. So the next one that we're going to do, for some people, it might be more of a mental activity than a physical activity. But I have 2 options. So I'll give you the first option. And if you're like, I cannot do that, you can always try the second option. So first option, I call them toe kisses. So putting your feet kind of close together, you're going to try and walk your big toe towards each other. So keeping your little toes nice and stable, and then walking your big toe out. So this might feel like more of a mental activity than an actual physical one. But it's really working on that toe, the extrinsic toe muscle for your big toe, which is your adductor hallucis muscle. An alternative, so if this is too much of a mental activity and you're like, okay, I need an alternative, what you're going to do is you're going to alternate your toes. So lifting your big toe, lowering your big toe, and then lifting your little toes. So lifting your big toe, lifting your little toes. Both are equally good, but most people see a little bit more improvement or quick improvement with the alternating toes than they do the toe kisses. So either one, the toe kisses or the alternating toes, are great. Excellent. Let's do about 5 more of those. Okay. I might be a little longer than 45 minutes. I have like 2 or 3 more things. I get too excited about exercises. Excellent. So next one, these are called yoga toes. So what you're going to do is you're going to take your fingers, and just like we did with the sock, you're going to wrap your fingers in between your toes. So just like this. Now, if you can't get your finger in between the little toes, that's okay. You can always just like either hold that finger out or just kind of rest it on top. Excellent. So once you have your fingers wrapped in between your toes, we're going to do 3 sets of a 5-second hold. So what you're going to do is you're going to squeeze your toes, squeeze your toes into your fingers for 5, 4, 3, 2, 1. And then you're going to relax everything in your foot. And then you're going to take your fingers and spread them. And spreading them for 5, 4, 3, 2, one, and then we're gonna reverse. So squeeze, 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 squeeze your fingers with your toes. So squeezing for 5, 4, 3, 2, 1, and then spreading your fingers with your, or spreading your toes with your fingers for 5, 4, 3, 2, 1, and then last one, squeeze, 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 squeeze those toes into those fingers. Really get the bottom of your foot activating. You may feel them kind of contract on the very bottom of your foot. Good. And then extending your fingers for another 5, 4, 3, 2, 1. Excellent. Now shake them out. See how that feels. You can kind of massage the bottom of the foot if it feels good. Okay, so if you get cramping in the bottom of your foot, I have one specific exercise that is for you. So your tarsal sinus kind of runs around this side of your foot. So your metatarsal sinus can get impinged, and that's why you can get that like cramping feeling in the bottom of your foot. So what you're going to do, you can do the seated or like in a chair. You're just going to extend your knee so your knee is straight. And then what you're going to do is you're going to tuck your toe in and then back up. If you feel kind of a stretch on the outside of your calf, I want you to go just before that stretch. If you're feeling kind of a numbness feeling in your toe, in your pinky toe or in your big toe, I want you to go just before that numbness sets in. So this is called a floss. So what we're doing is we're creating a little bit of stretch for that nerve that runs underneath the bottom of the foot.
Are you moving your ankle? That's okay?
Yep, yep. So most of the movement actually does come from your ankle. Good. So the last move is just with the towel. So this is the very last one, I promise. So what you're going to do is taking the towel. You could also do this with like a resistance band too. You're going to pull up as much as is comfortable, so not to a pain-free portion. And then holding a little bit of resistance with that towel, you're going to push your big toe down. Really driving that big toe. So the movement that I'm doing is lifting that big toe up and really driving it down. Now the towel is going to help with the range of motion. So you're using your arms to assist into that stretch, kind of similar to what we did with the ball and the tendon stretch. And then you're using those big toe muscles to really push down. Excellent. Let's do this on the other side too. Good. So doing 5 to 8 of those can really help that big toe. Excellent. So I'd love to hear any questions. I have time, and I'd love to help you guys out and make sure that we attacked all the goals that you have, or as many as we can in an hour.
Thank you. It was good.
So is there a way to find if we're getting progress, or if I guess pain is your guide to not do too much of something, but how do you know when things are working better? There's just less callus buildup on your bunion of the ball of your foot, or?
A little bit of both. So you probably will notice a significant, well, depends on the person, but you will notice a little bit of more control in the toe. So you might not notice a significant difference in the deformity of the actual bunion, but you might notice the ability to control the toe muscle a little bit more than you were previously. That's the big thing with bunions, and that's part of the reason why they can be painful, particularly with higher intensity activities, is because the toe doesn't have as much mobility, as well it doesn't have as much control. So when we give the body control, it tends to let go of that tightness, let go of that pain sensation, and say, okay, I can protect the body, I can do my job.
Jill, do you recommend, I think I said on the phone, the idea that you have another injury in your shoulder and you support all the shoulder with more muscle therapy. So we're kind of doing that for our feet now, which never 20 years ago when people didn't do that, they bought orthotics. Are orthotics a good idea? Because I've told they're like wearing a crutch all the time, and they're actually bad. You'll never get your therapy, your toe back to where it can be if you don't do exercises and you just rely on an orthotic.
Yeah, so that's a tricky, my personal opinion, this might not be everybody's opinion, is that orthotics are a great starting point. So they can help to give you that like pain-free portion at the beginning, but they, in my opinion, they should only be worn for a short amount of time. So like a month, 2 months, and they should be worn intermediate as you are strengthening your foot. So they're not a long-term solution in my opinion. They're really a short-term solution. So kind of what you were saying of like, they're like a brace, they're like a crutch. There's something that you should be used for a short period of time instead of a long-term solution. As well, some research that I've read recently, it actually came out in 2018. So it's not super recent, but it is quite recent, saying that the custom orthotics are just as good as the very basic generic orthotics that you can buy in the grocery store. So if your insurance covers, this is my personal recommendation, if your insurance covers the custom orthotics, and go for it. Get the really good quality, the one that's going to last for a long period of time that you can use every once in a while. But if your insurance doesn't cover the orthotics and you're like, okay, maybe I'll use it for a short period of time, go to the grocery store, go to Dr. Scholl's and pick up one that has a little bit of arch support. And I think that's based on that research study, it shows that that's an equivalent or an equal comparison to those custom orthotics. So
Okay, that's good.
that's my take on orthotics, I guess.
Yeah. Hey, are these exercises primarily, I guess, directed towards bunion issues? Is that what's what? Or?
So I try
because just quickly, my perspective and my issue is I do have a degenerative arthritis in my first metatarsal, and I've got a osteophyte, so I've got a spur on the top. I need an orthotic to kind of get the arch up, because if I flatten, essentially that osteophyte pinches together. Mm-hmm. And it just is pushed me towards a fusion at some point. So I routinely, because my foot tries to avoid that medial portion, it loads up on the outside, and I get a bunch of tightening in the outer part of the foot running up to the anterior chain of anterior tib. Mm-hmm.
Yeah.
So I'm just wondering is, hey, these are great for strengthening. I'm just wondering, is some of this possibly not directed? Hey, I just got a problem mechanically that's not going to be impacted as much.
So quite a few of the exercises are going to probably help with the whole tissue. So that's part of the reason that we spent a lot of time on all areas of the foot with those massages. Some of the strength exercises, for example, the arch lifts are going to be pretty important for that, as well as the coin passes. So working those intrinsic muscles to be able to
I lost you. Your audio. I don't know.
Can't hear your voice anymore, Jill.
There we go.
so
There you go.
so making sure that these muscles in here, so those toe spreading, so the yoga toes that we did, the
Okay.
coin passes are going to be pretty good. Another one that you can do that I kind of ran out of time for is a toe lift. So you can enter in, there's many different levels, but you can start with this guy. So taking a ball or an object, it doesn't have to be a ball, taking your foot and walking it over.
Okay.
Now you can do this standing, or if you want more resistance, you can enter into a wall sit. So engaging that really axial loading or pressure down into your feet, lifting your foot. Lifting your foot up and over.
Great. Thanks.
But
Yeah, I
there's
really
also-
found the sinus floss really helped on the kind of anterior chain and
yeah, that one's a
and
really
sit, yeah, that and massaging from the fifth met back.
yeah. So that really gets into this muscle here, into your digiti minimi muscles. Yeah, I think you can see that. Into your digiti minimi muscles.
Is there any reference that you suggest we can go to find out more of the muscle and just a better understanding from reference on the internet or books that you've got there? Or I imagine the other alternative is to come into a Competitive Edge for more help.
Yeah, well, I can help you as well. But a good person that I follow, or like a group that I follow on Instagram, is called Barefoot Canada.
Okay.
They don't post a ton of resources, but they will share other people's resources. So other athletic therapists or other physios that are posting information about feet overall.
That's on Instagram or Facebook?
I believe they're on
Website.
Instagram and Facebook, but they're for sure on Instagram.
Okay. This has been very helpful. Thank you.
Yeah, no worries.